Hey health warriors, ever had a test or treatment delayed, not because of a clinical issue, but because of paperwork? Today we're unpacking one of the most debated hurdles in modern healthcare, prior authorization. Is it really helping manage costs, or just holding up care? Prior authorization, or PA, is when a healthcare provider must get approval from the insurance company before delivering a specific service, test, procedure, or medication. It's part of utilization management, intended to prevent overuse, ensure clinical appropriateness, and contain costs. Examples of services requiring prior authorization. It applies to services like advanced imaging, such as CT or MRI scans, brand name medications, surgeries or hospital stays, and specialty referrals. But while it may protect the system, it can burden the bedside. So let's talk about the pros of prior authorization. It helps control unnecessary or duplicate care, which is great for everyone involved. It also encourages evidence-based medicine, ensuring that treatments are backed by solid research. Plus, it can reduce costs for both insurers and patients, which is always a good thing. And it identifies alternative, lower-cost treatments, making healthcare more affordable. Now, let's dive into the cons. This is where it gets a bit complicated. One major drawback is that it can delay care. Patients might have to wait days, even weeks, for critical services. It's also an administrative burden. Clinicians and case managers spend hours on calls and forms. This can be incredibly frustrating for patients, especially when they don't understand the process. And of course, denials and appeals can lead to treatment gaps or even worse outcomes. According to the AMA, 1 in 3 doctors report that prior authorizations have led to serious patient harm. How case managers and healthcare teams navigate it. Case managers are often the go-to professionals handling prior authorizations, but they're not alone. It's a team effort. Case managers submit prior authorization requests, gather clinical documentation, communicate with providers and insurance representatives, and appeal denials while following up relentlessly. Nurses and providers provide strong documentation and justification, know insurer guidelines and alternative codes, and counsel patients on timelines and expectations. Pharmacists and billing teams help identify covered alternatives and clarify formulary or tiered medication options. Prior authorization doesn't have to be a care roadblock, but it does require strategy, teamwork, and persistence. Bottom line, prior authorization is here. Let's manage it smarter. Until policies change, we need to work together to reduce delays, educate patients, and streamline the process wherever we can. How does your team handle the prior authorization headache? Share your strategies in the comments. We're all in this maze together. Like, subscribe, and follow for more healthcare insights that tackle the systems behind the scenes.